counties Victoria and Caroni currently account for almost 70% of the active cases of COVID-19 in the country. This according to Health Minister Terrence Deyalsingh, who says it is a concern. Sunil Lalla reports.
That is a worrying statistic.
Health Minister Terrence Deyalsingh says County Caroni and Victoria has generally reported an abnormally high number of COVID-19 cases, but notes that both counties now account for the majority of active cases.
Victoria is now accounting for over 3,000 or 50% of the 6,001 active cases, with County Caroni followed by 16%. So those two counties, Victoria and Caroni, are accounting for close to 66 to 70% of the active cases.
Chief Medical Officer Dr. ROSHAN said it is difficult to say why the numbers continue to be high in these counties.
They are highly dense population. When you deal with diseases such as this, you find the spread is related to the way people move and the way the housing is spread amongst the county, amongst other things. So it is really multifactorial, and it's difficult to say what attributes the higher numbers at this point in time.
With COVID-19 still circulating, Mr. Deyalsingh is urging citizens to be extra vigilant during the Easter holidays, noting that only 50% of the population is vaccinated.
If you're in a crowd of 100 people, based on the 1 and 2 ratio, 50 of those people are unvaccinated and pose a threat to you. And then you could take this virus home.
Mr. Deyalsingh is hoping the Easter period does not lead to an overwhelming of the parallel healthcare system, noting the uptick in cases that was experienced in 2021.
We don't want the post-Easter period to be one where the hospitals start to report higher levels of occupancy.
He is urging people to be careful how they socialize during the Easter period, especially if they are in a setting where the wearing of masks is not being followed. Sunil Lalla, TTT News.
In related news, one detected case of the Delta variant is causing some concern to the Ministry of Health. Chief Medical Officer Dr. ROSHAN says from genomic sequencing testing last week, the majority came back as the Omicron variant. But with one case of the Delta variant being detected in those samples, Dr. PARASRAM says it will be monitored closely by the Ministry of Health.
118 of those would have come back as Omicron, one case as Delta, which is, although it is one, it is concerning that we still have Delta circulating in the country. So that is a concern because of the severity of Delta in terms of it, in the way it causes severe disease and death.
Dr. PARASRAM adds that the worrying subvariant of Omicron also continues to show up in samples.
What we see in circulation is BA1 majority, but there's a significant amount of BA2, which is the sublineage that is causing a lot of issues in other parts of the world. We are now, based on last week's report, it accounted for 39% of the samples that were Omicron are BA2.
There are 374 new cases of COVID-19 in the country. This brings the total number of active cases in Trinidad and Tobago to 6,144. The Ministry of Health also reported 5 COVID-19 related deaths, 3 elderly men and 2 elderly women in the last 24 hours. The total number of deaths is now 3,792.